Okay, hello, my name is Mary Lewis, and I'm going to be conducting my head-to-toe assessment on Amber today. And for starters, I'm going to make sure that I do hand hygiene, which I don't have any. I'm just going to act like I did that. And make sure the room is warm and comfortable for her, and make sure that Amber has an empty bladder before starting it. So I collect and lay out all appropriate equipment. I wash my hands and maintain asepsis throughout the examination, and I utilize appropriate precautions. And so I'll start out with her general information, and just her age is 43. She identifies as a female, and she is a female. Her mental status is normal, and her nutritional status, it's normal. She's healthy.
I'm overweight.
She says she's overweight, but she's not.
Overweight.
She just okay. And there's no known obvious deformity, so she's good there. She looks healthy, and so I'm going to move to the skin. I'm going to go back to vital signs. I took those, and they were all normal. And so now I'm going to move on to the skin, and I'm going to just inspect pigmentation and vascularity. I'm going to inspect for lesions and anything like that. So there's no known lesions. Her pigmentation looks normal. Her skin is a little dry. So, yeah. And temperature feels normal, slightly warm, so that's normal. And now I'm going to test for capillary refill, and I'm just going to put pressure on her middle finger. I'll let go, and it's normal because it's less than 1 second. And then check for skin turgor. Okay, so I'm going to pinch under the clavicle, and it's normal. It goes back down, so no known dehydration. All right, now I'm going to move to the head and the neck. So I'm going to inspect and palpate the head for lesions. Everything feels normal there. She has a normocephalic head. And her hair is thick. She uses hair products, she told me. So, her scalp. Okay, her scalp feels normal. And now I'm going to check her sinuses by just, if you'll remove your glasses for me, I'm just going to put my thumbs. And it's normal to feel pressure, but no pain. So she felt pressure, but no pain. And, okay, so now the temporal. I'll check the temporal artery, and there's no bounding. It's normal. And for TMJ, I'll just
check both sides.
Checking for TMJ, and it's normal. So now I'll move to the cranial nerve 5, which is the cotton swab sensory test, which I'll just lightly touch her face, and she'll close her eyes, and it's a sensory function. So. Okay, so that's normal. And I already palpate master muscle while grinding teeth. That feels normal. Okay, now I'm going to move down to the cranial nerve 7, which is testing motor function only. So she's going to raise her eyebrows, close her eyes tight, and smile. So it's normal. So now I'm going to check all of her neck lymph nodes, and I shouldn't be able to palpate them. Okay, I'm going to start with the preocular, postauricular, occipital, and then I'll move to the jugular gastric, submandibular, submental, superficial cervical, deep cervical, posterior cervical, chain, and then I'll get her to shrug her shoulders forward and I'll check her supraclavicular nodes. That feels all normal. And so neck, I'll just inspect for symmetry, masses, scars, midlines of trachea, and JVD. Okay, so it looks midline, there's no, when I palpate, there's no masses, and there's no scars. And so now I'll palpate the thyroid. Okay. So I'll just sitting, and I'm going to push with my.
You gotta feel for the carotid.
Okay. I gotta feel for the carotid.
Not the carotid.
The
cricoid cartilage. Or
I have to feel
notch.
for the cricoid cartilage. So I'm gonna push with
the
my
little notch.
little notch. So I'm gonna push with my right, and I'm gonna palpate with my left, and that feels normal. And so now I'm going to move to palpating the parotid and submandibular salivary glands. So here, right here, parotid and submandibular. Okay, those feel normal. So osculate. I'm going to auscultate for carotid brute, and that's when I breathe. I'll take my stethoscope.
You have to breathe out and breathe back in.
Or I'll have her breathe out and breathe back in, and I'll just go down, and sounds normal. And then I'll check for range of motion and test for nuchal rigidity. So that's.
So what do you want to do?
Go back and forth.
And front and back.
So I'm going to get her to go front and back, and left and right. Do you experience any pain doing that? So that's normal. Range of motion is normal for that. And so now I'm going to test cranial nerve 10, the shoulder shrug, and that's where I'm going to push down on her shoulders, and she's going to push up. So I'm looking for a positive. So that's normal. And now I'm going to move to the eyes. I'm going to inspect the eyebrows, the sclera, the eyelids, the eyelashes, the conjunctiva, the cornea, and the iris. So the eyebrows look normal. They're symmetrical. And the sclera is nice and white. The eyelids, there's no dryness, there's no swelling, there's no drainage. The eyelashes are pretty. They look normal. The conjunctiva is there's some vascularity and pink, so that looks normal. The cornea, it looks normal. And the iris looks normal. So now I'll do the extraocular movements, which is cranial nerves 3, 4, and 6. Make your eyes do tricks. So I'll put a finger and I'll move it up, side, down, up, side, down. And she follows my finger, so that's normal. And now I'm going to do I'm just going to verbalize the visual acuity using the Snellen chart. It's where you would stand 20 feet away and read the letters on the chart, and whatever you can read to, that's your visual.
The smallest one.
The smallest one is your visual acuity. And now your near vision.
That's where you have the little Jaeger
Well,
chart or Jaeger.
The Jaeger chart, near vision, and that tests for near vision. And I'm just going to explain Perla. It's pupils equal, round, react to light, and accommodate. So if I were to do a pupillary light, direct, and consensual response, it's where I would just shine a light.
Yeah, we don't have a light.
And we don't have a light, so they react to light. So now I don't have an ophthalmoscope, so that does that. And now I'm going to move to the ears. So I'll inspect and palpate the external ear for size. Okay, they look normal in size, and their shape is normal. Is there any pain? There's no pain or discharge in external landmarks. If I was able to use the otoscope, I would be able to see the tympanic membrane and inside the ear. So all that would look normal. And then I would do the hearing test, which I would stand 2 feet back and I would tap on her tympanic membrane and I would whisper something in her ear and she would have to verbalize it back to me. And that's the whisper test. Okay, so now we're done with the eyes and we're going to move on to the nose, the mouth, and the pharynx. And so I'm going to inspect the external nose for symmetry, lesions, and edema. And her nose is symmetric. There are no lesions and no known edema. And right now she's got some allergies going on, so her nose is a little dry.
I've been blowing my nose.
She's been blowing her nose a lot. So now I'm going to inspect the internal nose for a deviated septum, masses, and discharge. And if I were to have a light or an otoscope, I would be able to look for, I'm just going to pretend like I'm looking for deviated septum and masses and discharge. No masses and discharge. So now I'm going to palpate the nose for patency, and I'm going to check, already. So that's where she puts one finger on the left and the right side of her nose, and she breathes in, and that's for patency. And now to check the cranial nerve, the olfactory nerve, which is smell, I would use something like an alcohol wipe or coffee beans so she could smell. And then I'm going to inspect all structures of the mouth and pharynx, such as the lips, teeth, gums, tongue, buccal mucosa, and posterior pharynx. And so she's going to open her mouth. Her teeth look normal. Her lips are nice and pink. Her gums are a pink color, and her tongue looks normal. And usually under the tongue is where you need to look because that's where a lot of mouth cancers can be. The buccal mucosa is moist, and the posterior pharynx. Okay, tongue, and she's gonna do her tongue, and she's gonna wiggle it side to side, and that's we can't do gag reflex because we don't have something for that. So, and I can't grade her tonsils. So now we're done with that. Now I'm going to move on to the chest and the lungs. I'm going to inspect and palpate posterior chest for lesions, retractions, and pain. And of course, if she weren't have a t-shirt on, I could see if she doesn't have any known lesions or retractions, and there's no pain.
No,
What-
no pain.
Okay.
And the posterior and anterior, I think I forgot to mention that on my video too.
Okay, so
Like,
posterior, I would just
you would check and palpate for pain.
I'll check for posterior. I'll check and palpate for pain, and retractions is normal, right?
But there's no retractions.
No retractions.
That would be if somebody's breathing through their abdomen.
Okay. So there's no pain there. And then I'm going to test for costovertebral angle tenderness, and that's where I'll just kind of hit my hand on the back and test for, I'll just do like, oh. Is there any pain?
No.
So there's no pain, so that's a good sign. Kidney inflammation. And now I'm going to inspect the respiratory movement, the AP transverse diameter expansion. So I'll just I'm lost.
Okay, for checking for transverse diameter, that's where you check the 1 to 2.
Okay, so she's a 1 to 2 in transverse diameter and expansion. Are you,
Remove chest
she's just
expands.
going to breathe in. Her chest expands normally. And palpate for meatus. And that's when I do the
99
yeah.
test. No, the 99. That's
okay,
the
that's when I
firmness.
just firmness. So I'll just go
99. 99. I do. I say 99. You feel, but you could also do it on my back.
Okay, so I'll just go to her back. So this is the posterior. So she'll
99, 99, 99, 99, and then you can just like keep doing
and I'll
it.
just do it. And I'll do it for the anterior too.
99, 99, 99. I mean, you don't have to necessarily do it, but you would come down this way. I believe that's how she did the video.
Okay, so she'll just go down this way. And so now I'll auscultate for lung sounds, and we'll just do posterior.
Whichever one you want to do.
Okay, I'm going to do posterior for lung sounds. And I'll get her to breathe in, breathe out, breathe in. Okay, lung sounds sound normal. And now, should I do inspect? I'll inspect and palpate anterior chest for lesions, retractions, and pain. So I'll just, is there any, there's no pain, and there's retraction.
No retractions.
No retractions.
Remember, retractions when somebody's having trouble breathing.
Okay,
They breathe
there's
through the
no
stomach.
known retractions, sorry.
That's retractions you just look for. You
Okay,
don't-
so there's no pain or retractions. Okay, so now I'm going to save the breast for the end, and so I'll move on to the cardiovascular. So I'm going to auscultate the heart. So I'll do
Whew.
no. Aortic, pulmonic, tympanic.
Tricuspid.
Oh,
You're listening at the valves. Aortic. It's all patients take meds.
aortic, pulmonic, tricuspid, and
It's aortic. It's like the second intercostal space, just to the right of the sternum. Aortic, pulmonic, tricuspid, and then mitral. That's
okay.
about
So
it.
I got those wrong. So aortic, pulmonic, tricuspid, and mitral. Sorry I got those wrong. But and that's all patients take meds. So those all sound normal. Inspect peripheral vascular color for
Varicosities.
varicosities. Did you?
I think I forgot.
Okay. So we'll palpate. I'm going to palpate for skin temperature and in lower extremities. So I'll just. There's no known edema or swelling, and her temperature feels normal. And I'll palpate all the pulse sites. So I'll start at carotid, temporal, brachial, radial, femoral, which is femoral, popliteal, dorsalis pedis, and posterior tibial. Okay. And there was no lower grade extremities for edema, grading edema, and that's 1 to 4, right? And so you've got a 0.
Yeah.
She's got no edema. You grade that from 1 to 4. Okay, fingers, and then I already did the fingers for capillary refill time, and that was less than 1 second, so that's normal. So now, and there's no clubbing, it's normal. And now I'm going to move to the abdomen. So this is where I'll get her to lay back. Gosh, I feel like okay. Okay. So if she were to have her shirt up, I would just She has I would check the contour, the symmetry for hernias and pulsations. Do I need to use my stuff?
Yeah, you got to listen to the Bible signs. You probably come over to this other side.
Okay. Okay, so I'll inspect the skin and her her belly button is inverted. And now all the contour is normal, the symmetry is normal, there's no hernias, and yes. Now I'm going to auscultate the quadrants for vowel sounds. So I'll start in the right upper quadrant and then move down to the right lower quadrant, and then I'll go to the left upper quadrant and left lower. So I'll do the right upper, the right lower, the left upper, and the left lower. And then now I'm going to percuss the quadrants, and I'm checking for tympani. I should hear tympani. Now I'm going to do light and deep palpation for masses, pain, and pulsations. So I'm going to start doing light. Is there any pain? And I'll move to deep. Still no pain. Okay. So there's no known masses that I feel. And yeah, pulsations are normal, right? Yeah, pulsations are normal. Okay, now I'm going to palpate the liver and the.
You didn't actually check on, but it's okay.
Should I? Did you check on it? Okay. Okay, so now I'm going to palpate for liver, spleen, and full bladder. So the liver's on the right side, and the spleen is on the left. So what I'll do is I'll put a pan behind her back, and I'll get you to sit up.
Oh, you don't have me sit. You just have me.
Oh, okay. And I'll just feel, and it's under the rib cage. And so I'll move to the spleen, which is on the left side. Put our hands and feel for the spleen. Okay, so that feels normal. Okay, so now I'm going to assess for abdominal signs, rebound tenderness, the muscle test, the Murphy abdominal signs. So there's no known tenderness. There's no tenderness. Okay.
But the shape for a rebound, is you push in on the left side and then let up. You just do it with one hand, though. I just did it with two
For
hands.
rebound tenderness, I test by pushing down,
Straight down. Like
straight
this.
down, and it should come up.
No, you bring it back up, and then if I have pain, then I have a positive
Oh, okay.
feedback. You just do it for a second, yeah.
And if she has pain, she has a positive rebound, but she does not have any pain. All right, and now we'll move to the musculoskeletal, and I'll inspect. I'll get you to stand back up. Okay. And I'm going to inspect for deformity, posture, gait, muscle atrophy, symmetry, alignment, and mobility of spine. And so if she'll just stand straight, and her posture is normal, her gait looks normal, and I'm going to test for scoliosis. So if she'll just bend down like she's touching her toes, and I'll make sure that her spine is not curving. It looks normal. And I'm going to do her to test for range of motion for major joints, including back and neck. She'll just do left to right.
Oh, sorry.
Or no, she can go back and forth or left to right. And she's got a smooth range of motion. And so now I'm going to assess for carpal tunnel sign, and that's when she's going to hold her hands like this, and she's supposed to do it for 60 seconds. And I'm supposed to, if she tap if she has any tingling.
Or maybe it's this side. I got to look that up because I can't remember.
Okay. So now I'm going to do the Romberg test, and that's this is the neurologic mental status, and I'm going to do the testing for balance by gait testing Romberg. Okay. So she's just going to stand straight, and she's going to close her eyes for 20 seconds. And there's not supposed to be any swaying or.
But you can sway a little bit.
You can sway a little bit, but. And now I'm going to get her to do the heel to toe walk. She closed. Okay. Wait, you don't want to close your eyes. No.
No.
And she just does her heel to toe, and she should have. No. Okay. So, now I'm going to do the alternating movements, finger to finger, finger to nose. So,
we're going to do that one first? Okay.
Wait, which one?
That's the alternating.
Oh, wait, testing of coordination by rapid. So, she's just going to do this, and that's testing for coordination. So that's normal. The alternating movements, finger to finger and finger to nose. So she's going to start up.
So.
Okay, and that was normal. And sharp.
Oh, I don't know what it's where do that? Was that?
Okay, so sharp. That's
the sensory test.
So this is the sensory test, and it's just gonna. This is gonna, since I don't have this is gonna be sharp, and this is gonna be dull. So you're gonna close your eyes.
It's sharp. Dull.
So that's normal, and now I'll move to. She's gonna sit back down, and I'm gonna do the deep tendon reflex, and I'm gonna do the knee. And so I'll just tap, and if I were to have something else, it would be. Woo. So that's a normal reflex. And now I'm done with that one, and now I'm gonna go back to the breast exam, which, do you do a monthly?
Yeah.
You check. Okay, so she does a monthly breast exam, and how you can do that, you can just go down and or you can do in circular motions. Sometimes it's better to do in the shower when you have soap on you. And you're supposed to do it 4 to 7 days after you start your period, and that's the better time to do it so your breasts are not full. So that is it, and that's it. Thank you.